Nossa convidada de hoje é a professora Patty Kostkova, um prazer imenso tê-la aqui. A professora Patty é professora em saúde digital e diretora do Centro de Saúde Pública Digital em Emergências da University College de Londres. A professora Patty já foi consultora da Organização Mundial de Saúde, de fundações privadas e empresas públicas. Ela é pesquisadora líder internacional nesta área nova de domínio inter e multidisciplinar da saúde pública digital. Ela é editora-chefe, por exemplo, da revista Frontiers in Digital Public Health, da seção de saúde pública digital. Ela também é a gerente e coordenadora científica de uma grande conferência global em saúde digital que acontece já pela 10ª vez. E ganhadora de vários prêmios. Eu poderia aqui destacar os prêmios de Inovadora do Ano, por 2 ocasiões, uma relacionada a pesquisas sobre prescrição de antibióticos na Nigéria e uma outra no período da Covid lá no Reino Unido. Ela também foi finalista de um prestigioso prêmio internacional de computação, de ciência da computação para a saúde, e chegou com seu time ao 2º lugar no prestigioso prêmio da British IT Industry Awards. Então, agora nós vamos mudar de português para inglês, mas não se preocupe, tudo vai ter aqui as legendas para que vocês possam acompanhar. So, thank you very much, Professor Patty Kostkova, for coming here and talking to us today. We're very, very happy to have you here.
It's my privilege to be here today, and I really look forward to exploring this exciting field of digital public health.
I wonder, really, how did it all start? It's, your early influences, and talk to us about your trajectory. How did you get to this place?
So my career has never been straightforward. I pretty much carved my own career. I was a computer scientist by training. I got my master and PhD in computer science. I come from computer science family. Both my parents are computer scientists, so is my sister. So it's a family, it runs through the family. But after my PhD, which was looking into kind of low-level computer science, systems architecture, I thought I want to do something more impactful. I want to do something which changes the world. And I happened to join a UK project funded at the time by Department of Health, the National Library of Health. And I joined the virtual library for infectious diseases. Initially, I took it as a 3-month kind of quick project to give me some experience and make some money while I'm doing job hunting in industry, where I initially wanted to go. However, I fell in love with digital public health. I felt that infectious diseases is a field which is tremendously exciting from computing perspective, from computational perspective, modeling diseases, and also developing digital interventions which can influence the human life, disease, treatment, and health of individuals and public.
You're in the right place now, because I think the UCL motto is actually knowledge to change the world, or something like that. It's fantastic to hear that. And tell me, so you fell in love with digital public health and the potential, and you got infected, if you wish, by the infectious disease potential for change in the world with the use of IT. And then tell me a little bit about which projects did you start doing, and how did this project added up to a long career in digital public health?
So as I mentioned, my first project was the National Library of Health. It was started by the Department of Health in the UK. And as a kind of a sister project, I have been running the infection control library called ENRIC, which initially again started by a Department of Health project to bring the best available evidence to professionals in IPC control in the UK hospitals, thinking, why don't we have a website which summarizes all the best policies and evidence for people who are busy in their hospitals, nurses, professionals, clinicians, so they have all the evidence in their fingertip. And this project has grown to become international. We have branched out to Africa, and ENRIC has become one of the most global projects over the last 15 years, delivering the best available evidence to infection control professionals in the world. The project has discontinued. However, this has been still one of my most favorite projects, where I really have seen the impact of technology at the point of care and helping people on the ground who are treating patients with the aid of technology and the best available evidence.
Maybe people may hear us today talking about this, and they can look at their mobile phones and then find those kinds of solutions. But on those days, this was not possible.
Absolutely not. At the time, penetration of mobile technology was limited. People didn't use to mobile phones the way they do now. So initially, this project, it goes back 15 years ago, was a website. And it was designed by my colleagues, and the content manager was a wonderful Sue Weisman, who was a nurse, a senior nurse in the UK, who was heading this project and making sure we really deliver the best available evidence, quality assured, to the point of care using a website. However, since then, we also branched an app, and it was a multi-solution. And obviously in Africa, the access of technology is limited due to limitations of resources. So we have gone straight into discussing the opportunities for the mobile access of this website.
Fantastic, and it's already changing the world. And I remember that you've mentioned in our previous conversations, and I'm glad to be a friend of yours. And I remember you saying that you also worked with gamification for children. Can you tell me a little bit about?
One of my kind of overarching theme was infection control and infection in general, but also antibiotic resistance. And I was involved in a large EU project developing a gamified educational resource for children, effectively serious games which teach children some knowledge and information around their health, around diseases, bugs, how to protect themselves, and also about antibiotic resistance. It was a multi-country EU project with 10 countries involved, and it was really exciting to see how kids actually enjoy learning through a gaming, as opposed to just learning, from textbooks in a school. So I loved it, and the kids did too.
I would like also to explore, you've been in so many different places, and as I know you from since a few years now, I know that you like to going to places and actually seeing how the reality is in the field. Yeah. So you've been to Nepal, to South Africa, and to Nigeria, where you did some fantastic work in antimicrobial resistance. Can you tell us a little bit and share your experiences by going there? Which are the experiences that taught you most?
That's a very good question. As I mentioned, I wanted to make an impact. So I really was naturally gravitating towards working in low-income settings. So these countries you mentioned, I was privileged to work in, and I really learned how much people can deliver at the point of care with very, very limited resources in countries like Nigeria, where in the middle of a hospital you would have power cuts, and people still have to treat their patients the best they can, despite the resource limitations we are just not used to in the UK and in Western Europe. So it was a humbling experience to work with professionals in Nigeria and other countries. The project you mentioned in Nepal, this was again a gamification project. We developed games for rural women who are quite often subject to complications with their pregnancy and neonatal health. So we developed a mobile game teaching them how to differentiate between high-risk conditions for maternal and neonatal health and which conditions are kind of okay to be perhaps managed by community nurses who comes to their rural villages maybe once a week. And it was a very humbling experience. We went to the field. We spent hours driving to these little villages, supported by a local NGO in Kathmandu. And it was great to see women who've never used a mobile phone before, seeing this device for the first time and wondering what to do with it and what is a touch screen and how do you drag and drop. So we have to do a few tutorials to help them to get the hang of it. But after a few hours, they really enjoyed it. These sessions were fantastically well attended, supportive, enthusiastic, and we could demonstrate they improve their knowledge on maternal neonatal health and also geohazards after playing this game with us.
Well, and for those who may not be aware of Nepal's geography. You know, you were talking about a very mountainous country with very far distances, and actually going to a health facility might be, you know, a huge challenge. It's like in the Amazon in Brazil, where some of the communities have, you know, are only reachable by boat, and you have to take a few days to go to a health facility.
Absolutely, this is a very good comparison. Many of these villages are extremely remote. Even for these sessions where we used to work, where we were meeting these women, they sometimes had to walk like for 2 to 3 hours from their village to get to these kind of central villages where these kind of women's groups were held. So for them, it was like an all-day trip to actually come to play the game with us and to share the experience and go back home. So it's very similar to the accessibility challenges you have in Brazil, in Amazonia, in some of those remote areas. So we were privileged and grateful that they took part in the project and really improved their knowledge.
I mean, there is a lot of conversation on the use of digital and artificial intelligence in terms of medical practice, in terms of bedside practice. But I guess that this approach of yours to look at public health applications, it's not only, you know, pursuing the, you know, educational programs, but also, as you mentioned before, the use of information on a real world and you know, time sensitive, I mean, a real time kind of data collection to actually look at data and anticipate outbreaks and be prepared for emergencies. This is one of your specialties. Would you like to comment on that as well?
I think you really put, like, you know, your figure on the tip. The research I have been designed was not just developing an academic exercise, which is tested and published as a scientific paper. We really went out to the community, delivered an interventions, co-authored and co-developed with the local communities and these end users. So as it's meeting their expectations, their needs, their cultural expectations as well. And actually we got it deployed in all those countries. So as a byproduct, we collected all the data from the usage of those technologies, not just demonstrating the knowledge change or attitude change or potential behavior change, but also understanding how people are interacting with the technology. And for surveillance purposes, like we do in Brazil, we are collecting data about, say, mosquito surveillance, which can be brought together with many heterogeneous data sources available around to develop early warning and response systems, so as we can respond to outbreaks much faster and much more efficiently.
Yeah, being those outbreaks and those challenges. For instance, you've mentioned you've worked with antimicrobial resistance, which has been considered one of the major challenges of the current global health conversation. And the other one is preparing for the next pandemic or the next big epidemics that you may encounter. So a very relevant subjects, and the use of these technologies may be, you know, understanding the tools and what they can do. For you and for us, it's a major game changer, isn't it?
Absolutely. I think I'd like to comment on how we have developed this project in Nigeria, which is looking at changing decision behavior in surgeons at the point of care for elective surgeries when they're prescribing antibiotics. The technology was again using gamification and persuasive technology, where we monitor the decisions that they are trying to make, and we run it against WHO and Stanford guidelines to see if the decision is in line with the guidelines or perhaps not. And we propose the surgeon or the end user in other cases what would be the appropriate prescription. And then we can measure at the point of care if the decision was changed as a result of the technology, or if they perhaps believed the decision doesn't need to be changed because of some local conditions or high infection control risk, for example, etc. So the GASDA tool in Nigeria was the first technology genuinely demonstrating as an antibiotic stewardship program decision change behavior at the point of care.
This is wonderful, and that's why you got, you know, the first of your Innovator of the Year prizes in 2019, and this has been listed as one of the major and most difficult problems in the healthcare in the world, which is convincing health professionals to abide to good practices such as washing hands, such as prescribing the right antibiotics, and it is fantastic. So we are talking about a very down-to-earth which antibiotics should be prescribed to avoid antimicrobial resistance at the bedside or at the surgical scenario. And then we are talking about a more kind of a public health in terms of the environmental issues. And that brings me to the current project we are actually involved with, which is to monitor mosquito population and vector density, and then also looking at disease occurrence in different parts of the world, and of course in Brazil, and with dengue, Zika, and chikungunya. Would you comment on that as well?
Mm-hmm. So this project has been going on for 5 years in Brazil, and I'm really privileged to work in this fantastic country. And as we know, with global warming, it is becoming not just a tropical issue. These diseases you mentioned, dengue, chikungunya, Zika, are no longer just tropical diseases. They are being kind of spread around and becoming endemic in middle climates as well. As you know, even in Europe, in southern Europe, we have regular dengue outbreaks in southern France and Italy. So it is becoming a major global challenge, and will become ever more so with global warming. So here in Brazil, we've been looking at developing a mobile app for environmental agents responsible for controlling the populations of mosquitoes here in Recife, but we also work in Olinda. Now we work in Cabedelo, in Paraíba. And also we have contacts in Manaus, in Amazonia. So we're spreading this project around the country to make sure we support the environmental agents to monitor mosquitoes using a technology. So the data is collected digitally, seamlessly reported. It simplifies the data sharing, the data control, but also it will feed into, as we discussed, the modeling and early warning system, where we could highlight where potential breeding hotspots are likely to be in the next few days. So the managers can send the environmental agents to those hotspots and be able to control the mosquitoes still in the larvae stage before they become adult mosquito and infect humans in a much more effective way than they're doing now without the technology.
And I like very much the approach that that you build the solution with the agents, and I've seen you in conversations with agents, and agents bringing agents to down to London to discuss this in major conferences, and field people who actually feel the pain of being there and not seeing the results of what they are collecting as data. And so it fascinates me the way of looking at the data that makes sense for someone in the field collecting and being able to act upon those information or data that they collect, but also at different levels of decision making, all the way to a national level, and to identify an outbreak that is just about to explode and to happen. So would you like to explore there further?
Mm-hmm.
That further?
I think this project was a good example of actually working, as you say, on the ground with the environmental agents to fully understand how they collect the data, what information they need to record when they're visiting routinely the properties in their responsible blocks or regions, and be able to collect the information to simplify the work they do on a paper, which has been very time consuming, and obviously there has been limited resources to digitize it. So to make sure the work they do is more efficient, seamlessly collected data, and is actionable at the local level. Also, it's good for their managers, so they can manage the progress, and they can perhaps reallocate the agents to parts of the city where there is maybe a delay or where the resources are most needed. So this is the direct impact on their work and what they practice. But obviously collecting the data gives us the opportunity to report it to the state level, to federal level, and of course international level. We're also working with other municipalities and the states to bring together stakeholders here in Brazil, and also we would like to link it to our work in Europe, in Portugal, in the island of Madeira, where we would like to harmonize the way the surveillance of mosquito is conducted, and the data should be collected in a very similar way with interoperability and understanding of the data collection, so it feeds into a very reliable early warning and response systems for the future.
And it's so important, as you mentioned, that these diseases, AIDS, Egypti transmitted diseases, are a problem of a larger part of the world, and it's becoming bigger and bigger. Actually, this year or last year, we just had the biggest epidemic ever of dengue in the Americas, and then different regions of Brazil that have never been exposed to such a big epidemic, but also parts of Central America, North America, the southern states of the United States, California, for instance, and as you mentioned, Europe, Southern Europe as well, and then other major challenges, all related to this concept of global warming and the concept of One Health. Would you discuss the implication? Because both of these examples, and I know that you've worked with different subjects, but antimicrobial resistance and mosquito control are both good examples of a One Health concept. Would you like to explore that a little bit for us?
Absolutely. So the One Health concept has been around for quite a while, for a couple of decades, but I think now recently, due to global warming, it has gained a much more prominence and traction. So we should look at diseases not just from the human perspective, but also from the animal perspective. So looking at zoonotic diseases and the veterinary care is as important for controlling the human cases and human diseases. So it is to look at the environment. So bringing together the environmental health, which doesn't include the projections of the climate change, the animal health, and the human health in this kind of triangle, is how we would like to see health being prevented, tackled, and managed going forward under the One Health agenda. And as you said, these are very good examples. The antibiotic resistance is definitely something which is cross-cutting human and animal health, as well as it obviously depends on the environment and the resistance patterns in various local areas, as well as the mosquito is very much related on the climate and environmental conditions on those areas. We need to control them better.
And let's not forget COVID, because COVID as well is a good example of a disease, a viral mutation that occurred because of this, a close proximity of humans and animals, wild animals and viruses, and so it's also another good example. And but again, maybe there is one missing link or missing aspect that I'd like to explore. And I know that you are very, because of your career choices, you've already demonstrated that, which is the issue of inequality. Because in this equation of predictability of diseases, you have the climate, you have population behavior, and you have many other different genetic predisposition to some extent, but also issues of inequality. What do you think about it? And what do you think? How do you think these all these aspects feed into your work?
I think it's been quite disappointing to see how much inequality has grown in the world in the last 30 years. And the public health is one of the striking examples of where inequality is directly affecting health outcomes. So we've seen it even in the UK, when health determinants have demonstrated that poverty in the UK is decreasing life expectancy in a G7 country. So very disappointing results. And in countries like Brazil, regarding the mosquito surveillance, how much work we do around mosquito prevention and control and supporting agents using digital technology, we cannot overcome the poverty and inequality in some of the areas, in some of the favelas, where people are struggling to have access to water, struggling to have access to sanitations and water management. And as a result of this, the standing water is sometimes where the breathing hotspots naturally are. So major investment in improving the quality of water and sanitations in those areas would make a leap forward in controlling mosquitoes and decreasing the human cases of dengue, chikungunya, and Zika. And that's what I think the policymakers should be focusing their attentions, is where the resources should be going, decreasing inequality and subsequently improving health.
Because we've seen different behavior of different diseases by just reducing inequalities, then you get improved outcomes. And we've discussed in a previous episode that it is not only true for the developing countries or say the middle income or low income countries, but also true for the high income countries, as the UK, as you've just mentioned. So very nice. And I think another issue is that people are discussing, and we have the optimists and we have the pessimists, and discussing the impacts of artificial intelligence and large language models, and all this is very hot topic. But I can see that you've been using those tools and technological tools to actually change for the better in terms of reducing inequalities and improving knowledge and changing behavior. And another point is you've been working with policymakers all the way through, in at least some of the projects I'm aware of, so that change and that knowledge becomes public policy. Would you give us some examples of that in your work?
I think you have tapped into an important thing. I think we all see that AI tools will becoming something which will revolutionize and simplify and deliver better healthcare globally. We can also see how this could be very well used in diagnostics, for example, where the technology is very mature and it can streamline and basically avoid some of the manual efforts we are having. On the other hand, we have to treat AI with caution. We have to have much more stronger safeguarding and regulation framework, which at the moment doesn't exist. We also have to be much stronger in terms of regulating data acquisition, data access, the use of data, not just for AI, but also for commercial exploitation. So we are now basically sharing our data with a few billionaires in Silicon Valley who make decisions about how the data is being used and how the technology, which like social media, which initially has been a tremendous opportunity for connecting people and sharing good idea, especially in some oppressive regimes, have turned into a technology which could be abused for spreading misinformation, hatred, influencing decisions of political debate, elections, and can be used against the democracy and humanity. So a stronger wake-up call and a regulation on this agenda, not just in health, but also in politics, I think is overdue.
It's overdue. And it makes me think about, any technology will have the same amazing, any disruptive technologies I mean, amazing possibilities and amazing and incredible risks as well attached to them. And I remember, with nuclear technology and there is an Oppenheimer Foundation now these days, and they are kind of pushing the agenda of the Atomic Energy Agency, also pushing the agenda of the pro-health use and the benefits that nuclear energy could bring to humanity. But again, at the same time, it can be used as a bomb. So the point is, we have to have people like you dedicated to making use of those new possibilities, at the same time discussing at a very high level the boundaries, the limits for that, so that it becomes, pro-humanity, not against it. Isn't that the case?
Yes, absolutely.
And perhaps democratizing the access and spreading around democratizing access and the use of those technologies is a big part of what you do.
Absolutely.
As well.
I think it also can be a social media use at the moment where it's concentrated in a few powerful hands is also a source of inequality. So making sure, as you said, we democratize it, and we will look into a different way of sharing data. People may be willing to pay subscription for using some of the social medias if their data are not going to be used for training AI or for being used for commercial purposes. So I think we have to look into how we can use these tools so they help humanity, help democracy, decrease inequality, and really bring a change to the ends of the world, as opposed to concentrating power and giving an opportunity for a big abuse.
So we cannot just, separate the political debate and the ethical debate and the technological debate, because they're all so much intricated, aren't they? And then, as an example, we are discussing technologies applied to health, but then we are now discussing limits of possibilities and the big debate. And in the global agenda, there is another debate that I would like to then perhaps listen to your view, which is the North-South relationship, and in terms of what is being discussed as decolonization of this global health debate. And I think that the way you do your work, that's my perspective, is pretty much in a kind of equal basis, which is very, very interesting. Would you like to say something about this issue of the big debate about decolonization?
So while the issue about the inequality caused by the AI and the need for a global regulation seems very much unresolved, I think the issue of colonization and decolonization, I think, has been quite widely adopted in most of Europe and the US. UCL itself has got a very strong decolonization agenda, and there is a strong push and celebration for genuinely having equitable relationships with researchers in the Global South. For example, one of the major funder, NIHR in the UK, this year have changed their policy. So PIs, the primary investigators, could come from low-income settings, not just from the UK, which is genuinely trying to see that the knowledge, the innovation and expertise comes from anywhere in the globe. And we really have to work together much more closely and learn from each other, regardless of where we come from.
Very good. I'm very happy with the discussion so far, and I wonder, part of the public who listens to these or watches us in these episodes are, sort of young public health, or in your case, IT professionals perhaps, that might be wondering to making a career in digital public health. Would you like to tell your story, or perhaps deliver a message to these people now?
I would love to deliver a message to a younger self or young students who, as you said, might be coming from the public health background and interested in technology, but also those like myself who are computer scientists, and we have thousands of computer scientists graduating from all the universities in the world who perhaps may not want to end up in the big tech. So if they're thinking, where I can use the knowledge to actually bring a global change, have an impact on saving human lives, then digital public health is definitely the place to go. The career isn't straightforward. I've carved my own career. I work for WHO. I went back into academia, but I still work on the intersection of those two disciplines with the focus on developing a real-world interventions on the ground in all those exciting countries where I have learned so much from the agents and the mothers in Nepal, the surgeons in Nigeria. Well, I really feel this is where the impact is genuinely felt, and it gives me a joy and a work satisfaction. So those of you who are students or young professionals and thinking about where you would direct your efforts, absolutely think about digital public health and to see how your life can change the world.
Well, maybe I should add that young people of any age, people, there is no actually age limit for that. There are people in the middle of, kind of a, when you get to 40s, 50s, your 40s, your 50s, there is a lot of movement in and around changing career perspectives. So I would just only add to my question to you, actually this message should go across and reach those who are young at any age. So.
Absolutely.
Yeah.
Absolutely. I think, especially after COVID, we have realized how much technology is needed for prevention and control and for delivering public health. So I think, as you said, it's not just a message for students and young professionals. It's a message for anyone who is in a position of any decision-making power in ministries of health, in public health institutes, who could think about upskilling and getting into the digital technology and being the driving force for changing public health for better.
And perhaps final word in how much interdisciplinary work do you have to face in your daily life, in your career? Because again, this is the core concept of digital public health, is the interdisciplinary work.
Absolutely. My work is entirely, intrinsically interdisciplinary. And this is what I love about it. As I mentioned, I wanted to leave computer science after my PhD because it was a single discipline, super exciting, intellectually challenging, but I wanted to learn something more, and I wanted to work on the intersection where I make a difference. So working with all these professionals, people from infection control and maternal health and antibiotic resistance, people who are epidemiologists and field epidemiologists, statisticians, nurses, behavior change scientists, all these have really kind of enriched my experience, my knowledge, and my understanding, and that's essential for delivering the kind of interventions and projects I've been working on throughout my career.
Então, para aqueles de vocês ou de nós que nos sentimos tocados e inspirados pela fala da professora Patty Kostkova, ela tem um convite a fazer.
Perhaps I can mention I'll be chairing the Digital Public House Conference. It's the 10th anniversary of the conference, and it will be held in the island of Madeira in Portugal at the end of July next year, 24th till 26th of July. There will be space for computer sciences, big data people, epidemiologists. So we really are successful in bringing together those two audiences, public health and computer science, and also innovators and industry, people who are genuinely developing interventions on the ground and wanting our patients or citizens to use them. So the innovators will be the third part of the triangle. So if you're interested, hope I inspired you, and I hope to see you in Madeira on 24th to 26th of July 2025.
So thank you so much, Patty. Thank you, Professor Patty Kostkova. Our interview ends now, but I hope that we can meet many times during our career and work, and good to have you as a friend. So thank you so much.
Jailson. It's been a real pleasure to be with you here today, and I hope these episodes will be also appreciated by the listeners. Maybe someone will be inspired into pursuing career in digital public health. I will be delighted to hear from you, and I really value your invitation, your support here in Brazil, and our friendship.
Então, se você curtiu este conteúdo, acesse o nosso site, fique por dentro de mais materiais gratuitos, além de cursos que farão toda a diferença na sua formação profissional. Não deixe de se inscrever também na newsletter do site, e se você está ouvindo nas plataformas digitais, a versão em vídeo está disponível no YouTube. Não deixe de se inscrever no canal e seguir as nossas redes sociais e interagir bastante conosco. Obrigado pela audiência e até um próximo episódio.